It's Dr. Mohsen Raza. Welcome to my new YouTube channel regarding medical updates. My today topic is about Gardasil vaccine. So what is the Gardasil vaccine is used for? It's used for the HPV infection. What HPV stands for is human papilloma virus. So one by one I will explain you about HPV. What are the way of transmission of HPV? The most common way of transmission of HPV is from using the contaminated things like scissor, razor, etc. and etc. It can be transmitted from the mucosal contact from one person to another person. It can also be transmitted from the contaminated swimming pool water, and also it can be transmitted from the mother to the fetus. So these are the most common way of transmission. Other ways are also possible. So what is the sign and symptom? The most common sign and symptoms of this viral infection is the wart. Wart can be genital wart. It can be on your larynx, causing the laryngeal papilloma. So it can also cause the other viral symptoms like flu, rhinorrhea, body pain, like coughing, sneezing, etc. and etc. So these are the most common sign and symptoms. What is the possible treatment or the prevention of this viral infection? So as I told you before, my topic is about Gardasil vaccine. So best way of prevention is using the Gardasil vaccine. Gardasil vaccine have the two types, type 4 and type 9. Type 4 is used against 4 types of the viruses of HPV, which are type 4, type 9, type 16 and type 18. So type 18 and type 16 are most malignant of them. They can cause the malignant cancer. But the type 4 and type 9 are common of them as compared to the other, but are less injurious or harmful for us. So Gardasil vaccine have type 4 and type 9. Type 4 is commonly available in the market. You can buy and use it for the HPV prevention. If you found type 9, definitely it will be better as compared to the 4. So this is the way of prevention. Now let's suppose you are infected with the virus, but you don't have symptoms. If you have symptoms, these are two different things. If you have symptoms, you can go for the treatment regarding to your symptoms. Let's suppose you have the warts on the genitalia. So the treatment available in the hospital for this thing is the cryotherapy. Cryotherapy causes the removal of warts. If you have the warts on the larynx, that as I told you before, laryngeal papilloma, it needs a laser surgery, carbon dioxide laser, which remove the warts from the larynx. So these are the very common treatment used for these warts. Now, if you are infected with the virus, but you are not having any sign and symptoms, what you have to do there? In the females, it's very important to follow this viral infection by using the pap smear after every 6 months, even if they don't have any symptom. After a suitable age, like 21, they should go for the proper pap smear test after every 6 months to rule out this infection. But in the male, if you think you are infected but you are not having any sign and symptoms, you should go for the proper lab test and rule out if you are having this infection or not. Because if you are not treating this infection, you can have cancer like penile cancer or any cancer of the genitalia or the rectum as well as the laryngeal cancers and so on. So in the female, the most common type of cancer can be the cervical cancer, so which is injurious for their health. Even it's a mortal, it can kill you. So take it seriously and follow it by using the protocols. So what is the most common age for using the Gardasil vaccine? In the female, the age range is from 9 years to 45 years. You can use in between 9 to 45 years of your lifetime, but it's better to use between 9 to 14 years of the age. Now the most commonly asked question regarding this thing is, people say that if we already had infection, and what should we do? Should we use vaccine or not? So the answer, according to the up to date, yes, you can use the vaccine. If you are already having the infection, definitely go for the vaccination. Use the 3 doses of the Gardasil vaccine, and also go for the pap smear test side by side after every 6 months to follow the results. So one more thing I would like to add on this HPV description is how many doses should you use for the vaccination. It depends upon the age. If you are having vaccination between 9 to 14 years, in the females between 9 to 14 years, only 2 doses of vaccine are enough. But if you are above 14 years of age till the 45, you have to take 3 doses of the Gardasil vaccines. And these vaccines are used IM, that is intramuscular. And after vaccine, you can have symptoms like temperature, body pain, and pain of the site of injection. So these are very common. Don't be afraid. Don't get scared about these symptoms. If you had any question, please ask me in the comments. I will answer you as soon as possible. Thank you so much. And please don't forget to subscribe my channel and ring the bell icon to keep in touch with me.